Some of the most dangerous infection control risks in Med Surg aren't dramatic, they're invisible. And the nurse who catches them isn't the one that memorized all the PPE rules, it's the one that knows where they're hiding. By the end of this video, you'll be able to walk into any patient room and identify the 3 infection control risks that most students miss. And you'll also be able to respond to them using the 4 Ps. Students often struggle with infection control in Med Surg because it's often taught like a rule book. But real Med Surg nursing isn't about memorizing isolation rules. It's about anticipating risks before they reach your patient. Today, we are going to simplify infection control into 3 simple risk zones, and you'll be able to scan for them in less than 10 seconds. All right, let's get right into it. These are the 3 risk zones that we need to be looking out for. Risk zone number 1, the patient. The patient might have wounds or devices such as Foley catheters, central lines, wound vacs. They might be immunocompromised, and they also might have mobility limitations which cause higher risk too. So number 1, the patient. Risk zone number 2 is the nurse. That's you, that's me, and that's our coworkers. We might bring in infection on our hands, on our clothing, any equipment that we might bring into the room, and any shortcuts that we might take. And risk zone number 3 is the environment. So think about your patient's room. We have bed rails, an overbed table. We have any kind of shared equipment like blood pressure cuffs or thermometers, and also potentially a cluttered room. We might have old trash or linens or any kind of medical supplies that are gathering infection risk as well. And our master's degree student, Tessa, has put together a beautiful visual for us, showing us those 3 risk zones, and that is where you're going to be able to do an easy scan and identify risks in these 3 areas. Next is where our 4 Ps begin. So the first P is for pause. This is going to be the doorway pause. So we are going to start looking around. What do we see? What's going on? Do we see an isolation cart? Are there family members around? Is there a roommate? Is there shared equipment? Is there clutter? Anything else that might pop into our minds that falls into one of these 3 risk zones. Now we're ready to apply our next 3 Ps, our prioritize, plan, and prove. And to do that, we're going to look at 3 short patient scenarios to see what we find. All right, our first patient is a pneumonia patient who has new confusion and also a Foley. So this is known as the Foley catheter trap. And so to start off with, we pause and we see that the confusion is new and they have a device. So that's definitely a risk for infection. Next, we have to prioritize the patient's care. And the most important thing that could be going on right now is a catheter-associated UTI. So we're going to have to go with that angle first. When we suspect a catheter-related infection, we have 2 main things to do. First, we have to identify any misuses in the Foley. Is the catheter bag elevated too high? Is it pulling at the patient? Is it not properly been cleaned? And secondly, we have to check the urine. So we would probably send off a UA-CNS, take a look at the urine to see if it's cloudy, if there's any odor associated with it. But we're essentially investigating this urine to see if there's a problem. And in our 4th P, prove, this is our 4th step in the clinical judgment process, and we have to figure out, was there really an infection or not? Did our UA-CNS, did our assessments find any problems with the way the catheter was being used and possibly identify a connection to the confusion? And if we did find that there was infection, then we're going to move on to the next step, would be treatment. Our second case is the case of the wrong roommate. So we have one patient with neutropenic precautions and another patient with RSV. So as we pause and reflect, we see that this is an immune status mismatch. So our prioritization is going to be to prioritize the most vulnerable patient first. After we identify this mismatch, our plan is going to be involved correcting it. So we're going to have to request a roommate change. So we're going to have to get our supervisor involved, our manager involved, and move one of these patients, and then really reinforce the isolation. In our final phase, the prove phase, we're going to have to monitor the neutropenic patient very carefully to ensure that they didn't acquire any infection as this mismatch occurred. And our third case is the case of the dirty stethoscope. So nurses use the same equipment all the time from patient to patient. So first of all, we have to pause and say, that's a risk. We are using the same equipment on multiple people. That is a risk. We prioritize breaking the chain of infection. Our plan is going to be planning to clean our equipment between patient use. And our prove step, our last step, is going to be doing another doorway check and making sure you enter rooms with clean stethoscopes every time. And we have another wonderful visual aid by Tessa. Just check this out and let it sink in a little bit. And hopefully you'll be able to use it in clinical on a regular basis. Thanks, Tessa. You're just awesome. I don't know how you fit all this planning in when you're working on so hard on school as well. This is how confident nurses think. They don't memorize every rule and every isolation precaution possible. They look for patterns and they do the right thing. Thanks, Tessa. What a great visual aid to reinforce our framework. Pause, prioritize, plan, and prove. Summarizes clinical judgment in a wonderful way, and we can all learn from that. If you'd like to go deeper with clinical judgment and safety, I'll attach a link to several other videos you can check out in the comment section below. Remember, infection control isn't about fear. It's about noticing small patterns, things that are almost invisible, and planning to correct them before they hurt any patient. Thanks for tuning in. I hope you'll join Tessa and I again next week.